Um, so that was just something that I feel like I gained through doing that. Something I wish I had known prior to starting, I would say that would go more into like finding a job afterwards. So definitely looking earlier than later is important because your loans start right away. So you don't push it off. And then, like I said, looking into the office that you plan on working for, because there's a bunch of different offices. Like Olga mentioned, there's insurance based, fee for service, and depending on how you like to work and the like ethics and everything that you stand for is important when finding an office that you want to work for. Um, so I think that's pretty much it. Oh, and also mentorship was big. So with the GPR, we have, or at least for the GPR that I went to, still like a study club. So we meet twice a year, even after our residency is over. So you can still like pick the brains of your attendings, get to meet like new dentists. So mentorship, I feel like in this field is very important. You're going to have questions. You're going to run into things that you don't know, how to answer. And then learning the business of dentistry, I think, is very, very important because it's not something they stress a lot in dental school, but it's very important when you graduate because making money is something that you need to know how to do, and especially do it the right way. So that's something that I would also say is important. Finding a mentor or like being involved in this is very good, at least starting out.
Jaya, I just want to piggyback off of something you said. So wanted to get experience with like endo, oral surgery, things like that. So for me, since I knew the practice that I was going into has specialists, so they have an endodontist, they have an oral surgeon. It didn't it didn't make sense for me to go down the path that you went because first of all, I didn't want to do endo, so that was easy. Oral surgery, yes, I like and I do, but it made the decision to go into private practice a little bit easier versus going to a hospital based GPR because you have to, again, like going back to what Jaya said, knowing knowing what you might want. It's okay to not know exactly what you want. You won't really know that until you're in it. However, I think shadowing different types of dentists and trying to understand what you might want when you graduate is very important. I would say start that as early as like your D3, early D4 year. Because the way you may want to practice can dictate the direction you go, so for Jaya, that meant learning those procedures. For me, I was totally fine with being comfortable with the restorative side and not really looking into the endo and the specialty procedures, and I'm still happy with that decision.
Thank you. Dr. Emma?
Hello, everyone. So I have, I guess, three different perspectives to discuss. I did do GPR. I was in private practice, and I was in the DSO. My decision to do a GPR is because I live in New York and I have to. I have to do a GPR to obtain my license here, so that was my choice. But also, I did feel like I did not get enough experience in dental school. I went to the university at Buffalo and I was able to finagle my way to get certain procedures and do certain things in my D4 year. But there were certain procedures that I still didn't do. So I was doing veneers, I was doing quadrant dentistry, I was doing that my D4 year, but I did not do one molar root canal. I did not do one surgical extraction. So there were certain things that I felt that I needed a GPR to get that experience versus doing an AEGD. Now, I have comments about residencies as well, but we could go into that at a different time. So I did my residency, but even so, I didn't do my first molar endo until 6 months into the residency. But especially being in New York is highly competitive. It's highly competitive. It's super saturated. So they want new dentists to do all those procedures. They want you to do endo. They want you to do extractions. They want you to do all of that. I'm going to get hired over someone else because I do molar endo. I'm going to get hired over someone else because I do surgical extractions. I'm Botox certified. I have all these different things that you have to get under your belt to be competitive because it's so saturated in New York. We have multiple dental schools. Hundreds of people come out of NYU. So even just in that, you need to level yourself up. So you have to be able to do a lot of procedures, especially going into private practice. In New York City and for a lot of big cities, you're going to have to be able to do all those things, especially because a lot of the times the dentists that are trying to hire you are not trying to do the procedures that they don't want to do. So they want you to be able to do certain procedures. So that's why I felt it was important for me to do a residency. And then I went into private practice. And then what the two docs already mentioned, please, this was something I did not do. Go into those practices and see how they function before you commit to working there. Real life dentistry is not what they teach you in school. And there's the good and the bad to that, right? The good to that is, it's not realistic that you're seeing two patients a day. You wouldn't make money like that. You have to focus. I don't want to say focus a lot on insurances and things like that. But if you work at a practice where they take insurance, you need to be familiar with insurances. I remember my first day working at a practice, a patient came in for an emergency, and this was a practice that took Medicaid. They came in for an emergency, they needed an extraction, and I was like, yeah, of course I could do that. And then the manager was just like, Doc, you sure? You sure you could do that? And I'm confused, like, if she's asking about my capabilities, and it wasn't even that. She was asking me if I was sure I could do it because she's like, how long is it going to take you? And Medicaid pays $45. So is that worth your hour? And you only getting 30% of that $45. So, and then that's something that I never had to think about in school, never had to think about in residency. And then now you're in real life and you're kind of picking and choosing, like, is it even worth doing these procedures? Because it's not going to pay me enough to do these procedures. It's not enough chair time. That's why they're getting referred to the oral surgeon, because at least the oral surgeon get paid $150 instead of $45 for it, right? So there's certain things that you are going to have to learn about what's profitable in your hour once you go into private practice, because it's very heavily based on that in terms of your production. If you're getting paid off of production, you need to make your hands work for you. So I did private practice for 4 years, and I was in many different practices that took government insurance, PPO offices, and fee-for-service offices. It was useful to have all those experiences. I would say, especially with the Medicaid practices, I was able to get really fast. I was doing endo almost every single day. So that made me more desirable for the PPO practices. But then eventually I did end up going to a DSO. And the honest reason for that was because I wanted benefits. When you are in private practice, for the most part, you are not going to get a benefits plan. You're not going to have PTO. You're not going to have 401k. You're not going to have insurance. You're not going to have all these things. Because even if certain practices offer it, because they do, it's expensive. And then, yes, do we make decent money? We do make decent money. But when we live in big cities, we have these loan repayments, we have all these things, like, do I want to pay $800 a month to buy into this plan? Probably not, right? So a lot of us be risking it all, and we're doctors without insurance. And trust me, I know, because I was one of those people. And the owners, these people who in their 50s and 60s, they don't have insurance either. And I'd be like, you're really playing with your life, because at least I'm young. So I feel like it's worth risking it. So, that's honestly the reason why I went into a DSO, was to get those benefits. Now, going into a DSO is going to have its pros and cons as well. The benefits are the big pros, right? Now I have PTO. Now, I have insurance, right? I went to all my doctor's visits because I'm like, I haven't been to a doctor in 4 years. So it's like, I did all those things. I was able to take advantage of being in a DSO. 401k, they do a match. Certain DSOs, they give you stipends for CE. There's other DSOs that send you to CE that is not even a stipend, is that they're constantly training you. So you have to make a decision as to what are the pros and cons and what are you trying to do. What is your end goal? That's another thing that you have to think about when you're deciding what you want to do. Is your end goal practice ownership? Is your end goal to use dentistry to make your money and then do something else? Because a lot of people do that as well. Is your end goal to be in education? What is your end goal? Because that's going to dictate what you want to do. Do you want to buy into a DSO, right? Now you have to go to a DSO that does that. I was at a DSO that didn't let doctors buy in, right? So that was never the plan. with private practice, I don't want to own. I don't desire ownership, right? So there's certain things that you have to do when you're deciding, okay, what's going to be more beneficial? Even going into a DSO, you can learn the systems and strategies because a lot of the times that's what they really have down. That's why they exist. You could learn the systems and strategy and apply that to private practice if you know ultimately I want to be in private practice. But you know what? These first few years, I want to take advantage of all the training that the DSOs paid for. I want to take advantage of the insurance. I want to take advantage of these things. So there's pluses and minuses to all type of practices in dentistry, whether you're doing private practice or whether you're doing a DSO. Um, you know, the perception that you're going to get taken advantage of being at a DSO, you could get taken advantage of at private practice as well. So that doesn't really matter. When you're the small dog, you're going to be the small dog everywhere. So for me, how I combated that was making sure that I was proficient in everything I did. I took a lot of CE. I made sure I was highly trained. So if anyone tried to take advantage of me, I had the energy like I will quit today. And that's just how my energy has always been, because you need to know your worth. You need to know your worth, but you have to be competent to be able to go into rooms with that type of energy, especially with corporations, because corporations will not care. It's a little bit different with corporations than when you're dealing one-on-one with a mom and pop, one-on-one with a mentor. Mentorship is key. I would say that I honestly got more mentorship at a DSO than I did at private practice, right? But that was because I was so competent that as soon as they saw I was competent, I ain't see the owners no more. It became my practice and my patients. So that's something that happens as well. People practice, they promise mentorship, but then they disappear, right? Because they see that, oh, you can handle the procedures. Because I am the doctor that does everything, they were comfortable enough to leave their patients to me. So I wasn't getting mentorship. You can't really get mentorship if you're the only person in the practice. So those are also things that you really have to consider when you're looking at offices. But I would say the biggest takeaway, which is something that, the other docs mentioned, is shadow the offices before you go there. Because there's a lot of shit that happens in private practice that would surprise you. Especially, there's old school docs that they don't believe in the rubber dam. They don't believe in certain things that you couldn't even imagine not working with. And you go into practices and they just won't have the supplies that you're used to in dental school.
Thank you. Thank you. And Dr. Camille?
Hi, I'm Camille, everyone. Um, so I was in Jaya's class. Jaya and I were classmates, and then I decided to do a AEGD. I don't know if anybody really knows about it. When I was deciding, I didn't really know about it. Um, I went to Rutgers University, and like they're really big on GPR. They're like GPR heavy. They want you to do one. So all that was exposed to me was a GPR. And then I'm originally from Florida and Rutgers is in New Jersey. So I was like, ugh, go back home. I don't know what I should do. I was looking at GPRs in Florida and I don't know if any of you are, but there's only three and two of which I was not willing to go. One was where I would have to pay tuition, and the other one was very far away from my home, which ultimately, if that was the case, I should just stay in Jersey. Um, that being said, I was like, I guess I should look into AEGDs. And then in Florida, there's a bunch. I That was the best decision I could have made. And it was honestly on a whim because I wanted to go home so badly. But I know everybody's experience is different. Compared to GPR and AEGD is more clinical based, I feel like I learned a lot about dentistry in terms of what I wanted to do day to day, but I didn't know that going in. Um, Ultimately, I was taught like how my schedule should look, how I'm gonna make money every day in order to be productive, what it even means to be productive. So these are all things that weren't taught to us in dental school. And I also feel like just hearing things from like my friends who did GPRs, that's not something that they were taught either in GPRs. But when I was at my residency, it was like my attending took the time out because there was the day to be like, you have to be able to see X amount of patients to make this much money. And is it worth seeing them, like Dr. Emma was saying, like, sure, you can do an extraction, but how long is it going to take you? And is it worth the hour if it's only 45 minutes and then you're only getting 30% of whatever the extraction costs? So, like, if you can do extract in start to finish 10 minutes, of course it's worth it. But if it's going to take you longer, you have to weigh the cost and benefit. So I feel like an AEGD really taught me all of those ins and outs, which ultimately luckily for me, that was the path I wanted to take, but I didn't know I wanted to take it. So I wish I had known before starting was what I wanted to do. So in my AGD, I I was like, what kind of dentist do I want to be? So I finished and I was like, where do I do DSO? Do I do private practice? Um, and in Florida, the competition, I'm in South Florida, if anyone in like the Broward, Miami-Dade area. So it's very, very saturated. And I feel like there's a lot of other places that can be saturated. So you have to do what's best for you, right? And I love the fact that I did a residency, but in Florida, looking back, it doesn't make a lot of sense. Most dental students coming out of dental school go practice, whether that's through private practice or DSO. It's mainly DSO because they will be willing to hire like new graduates. Had I known that, I'd have gone that route because I wanted to be in this market of South Florida. Um, they the area that I'm in, they don't view my AEGD as a one experience. They just see it as an extra year of dental school, which was hard for me because here I am thinking again, I got it from Rutgers, like you need to do a residency. It's gonna look so good. Um, Dentists are gonna watch you and see that you went this. I don't know if you guys follow like dental nachos on Instagram, but they always post like the little polls for dentists like did you do an AGD/GPR, and it gives you this like one up. For me, it did not give me a one up. If I had known the area that I was going to work in was going to be so difficult to find a job, I would have just did the DSO route because, like I said, a lot of new graduates straight from dental school can get into DSO and then they get that experience, like Dr. Emma was saying, through the DSO. Like there's doctors there willing to help you, willing to mentor you, which is great. Ultimately, where I'm at right now, so I finished my residency and I am both at a private practice and a DSO. I work at DSO full time, but it's 4 days a week. And then on that one off, it's a Friday, that one off day that I'm not at the DSO, I am working private practice. So being at both gives me exposure to both. And I feel like as a new dentist, this is your time to like really be aggressive. This is your time to learn, to prove to not only yourself, but also employers that are out there that you're willing to work to make that sacrifice and go above and beyond whatever else is out there because your competition is your classmate. And that's hard to say because those are also your friends, but it's true. So you have to make yourself different amongst everybody else. But what are you willing to do and sacrifice? I know that I have people who went to dental school in Florida and they're satisfied with working that 4 days a week. But I'm not. I want as much experience as I could possibly get just because my next job, I know what I'm looking for now. So it's just like now I can little things that you learn from every office, DSO, private practice, or which one, it's gonna be different. Even if it's the same DSO, the location of the DSO, the people who are in it, your experience will always be. So someone can go to one DSO and be so happy. And then I can go to that same exact DSO and be happy because of the quality of the people inside of that specific office that you're at. Because of that, you're going to want to know what you're looking for. And if it's not working, you have to know that it's not working and be able to adjust mindset and ask for the help that you need. Um, but yeah.
Thank you, ladies. That was great. Great responses. So the second question is, what unique opportunity or experience has your chosen path provided you that others might not expect? And we'll start with Dr. Olga. So you're muted.
Sorry, I said I'm back. I think everyone is bringing up really great points. Presh, I think you did a good job at picking people who had very different experiences because I think all of these points are good for everyone to hear. So a unique opportunity or experience. So for me personally, I definitely agree 1,000% with the points made about, first of all, getting as much experience as you can, taking quality CE. There's a difference. There's CE and then there's CE that is worth your time and money. I think there's a huge difference there, and it's important to try to ask people, I guess, ask people who ask us, ask people who have taken CE, kind of what their experience is with it before signing up, because CE is very, very expensive. But one thing that I've been able to do since graduating, so when I was a D4, I applied for a Dawson Academy scholarship. So there's a lot of institutes. I'm sure you guys have heard. There's Coist, there's Pinky, Spear, and there's Dawson. There's others, but I applied for this Dawson scholarship. Ended up getting it, which was shocking, but I got it and it was great. And so that scholarship has basically, in this first year out of school, allowed me to take about 30,000. I'm not done with it yet. I'll be done in May, but about $30,000 worth of CE for free. So for me, that has been a very unique opportunity and honestly like a game changer. So there are these opportunities with the different institutes that I mentioned. There are, I know, like as a D4, you can also go and, join some of the seminars that they do in the fall and the spring with some of these institutes. So I would just say search all of these opportunities early so that you can apply for them. If that's something you're interested in. For anyone that doesn't know the Dawson Institute, they're more focused on restorative dentistry and basically restoring people's dentition from a stable joint position and CR and all of these things that you kind of learn in dental school. However, these types of courses allow you to kind of apply them and practice this way. So if you do go straight into private practice, I would say one thing that this was already mentioned, but one thing is really need to invest in yourself, invest in taking high level CE in your learning. Just because you're done with school doesn't mean the learning is over. I would even argue that the learning is almost just beginning. And I would say create a plan for yourself to figure out how you're going to afford the CE in your first year. Your first year out of school is not the year you're going to be making all of the big bucks or the most you'll make in your career at all. So I would say one thing I did, it was my only choice, was take out a little bit of loans extra in my last semester of my senior year so that I could take some CE. the first year of work, and also so that I could have a little bit of a cushion in case I wasn't, making as money as I expected. So for me, that worked. I understand that for others, taking out more loans might not be something you're able to do. But if you are going into private practice, I would say just don't view it as, you know, I'm working and that's it. It's still learning, or you still should be learning, because that's how you can not only differentiate yourself to find a job, but also differentiate yourself to your patients and provide a service. And because it's not just competitive when you get the job, it's competitive when you're a dentist and there's 10 dentists in a 1 mile radius, right? So you still do need to differentiate yourself and kind of provide a value to patients. And so I personally think the only way you can do this is through high level CE. So that's what my advice would be on this question.
Thank you. And also, I'm very proud of you for getting that. That was an
Yeah.
academy. You did a good job.
Oh, Precious was my editor. Couldn't have done it without her.
No, all you. All you. So, Dr. Jaya.
All right. So I would say a unique opportunity that or I guess an experience that has helped me in private practice would be through my GPR. So I feel like through doing that, I have a better understanding of like patient management, because like I mentioned, we saw everything under the sun. So like when emergencies come in, I feel confident, in treating them, when to refer, like I mentioned, when not to. But also, like I mentioned about mentorship. So that was definitely a good opportunity that I've gained from my GPR, because anytime I have a question, all of the attendings that I've worked with are like a phone call away. So I never feel like I'm in the dark, even though, like I said, one of the jobs that I work with, I actually work with one of my attendings. So that was also nice. I got my job through my GPR. So the people that you meet, and like the experiences that you gain through, doing continuing education, like Olga mentioned, or an AEGD or a GPR is important. You can, the other doctor mentioned, also doing that through a DSO, but CE is also very, very important in one, differentiating yourself, but also making sure that you're competent, because dental school teaches you a lot, but it doesn't teach you everything. So even more in-depth procedures, if you're doing like full mouth restorations or whatever you're interested in, make sure that you're taking those CE courses. I know that I was interested in cosmetic dentistry, and in dental school, you're taking, state insurance. So it's not that common to be doing full mouth rehabilitation in dental school. So one of the jobs that I work at provided CE, like money for me to take a CE course in New York. It's called The Art of Ceramics, which was a great experience. So I learned all about like veneers, the process, the materials, and all things like that. But you also get to meet a variety of dentists from all around the world, and that's another networking, opportunity, because you never know. I met 2 dentists that are nearby in New Jersey, that I now stay in touch with. So it's important, even if you're looking for another job, to have those connections as well. So that's that.
Thank you. That was the first time I heard of someone getting a job from their GPR. I didn't know that was a thing. So great to keep in mind. And Dr. Emma?
I would say that an experience that you may not expect is building your leadership, and whether that's in a private practice or in a DSO, where, like I mentioned before, you may get thrown into having your own practice indirectly, without even knowing, where clinically you do what you need to do, and then if you have a more absent owner, right, you end up being the leader of the team, right? So the assistants are looking to you, the hygienists are looking to you, the front desk is looking to you. You kind of start to manage the way you want to run a practice, per se, even if it's not yours, as an associate. So there is many leadership opportunities, and whether you want them or not, that happens, because you're the doctor, you're the doctor. So everyone is going to look to you as the leader, regardless is if you're the owner of the practice. And I've had that experience in private practice, and I've had that experience in DSO as well. Especially if you naturally, have a certain personality, people are going to look to you anyway. So I would say that would be, and that was a good experience for me where I see what I could do, what I'm capable of. You also could see in your different forms of practice what you don't want to do, when you're an owner. So you definitely want to take the good and bad of what you see when you're in private practice and in DSO. And then, like Dr. Camille said, you could be in one practice and hate it, and another doctor could be in another practice and love it. So the biggest thing, which is something that, I still feel like I battle with, is trying to really know what you want to do when you graduate so you're not disappointed in the field. Because I would say, and I don't want to be grim because a lot of you guys are in school, but a lot of new dentists that are out, I'm 8 years out, but I'm still considered a new dentist, is, a lot of people are disappointed in the field or disappointed in, the prospects, the job opportunities, the amount of money we make compared to the debt we have. Like, there's a lot of things that you could be disappointed about regardless of loving it. Like, I love dentistry. I love what I do, but sometimes I feel like this is very ghetto. I need to just find like a rich man to help my life out. Like, so um it's one of those things where I feel like a lot of that comes from not really knowing what you want to do, right? You may want to do dentistry because you love it, you like teeth, you had an experience, whatever reason that you ended up in dental school, but then there was no plan after. That was my issue. My goal in life was to become a dentist. I never planned after graduation. It was, I'm a dentist. And then I did that, and then I was like, okay. So what we do now? Because the expectation, and it still hasn't really changed. I feel like in the industry, the expectation is for you to own eventually. So then when you don't want to own, you're like, what's wrong with you? Why don't you want to own? But then he's like, well, if you don't want to own, then what do you want to do? And it's like, wow, I don't know, because no one ever really spoke to us about what else can we do. Right. So I would say it's important that you guys are here tonight. It's important that you keep talking to different people so you could kind of figure out, okay, even you may not know exactly, right? Because you may go into private practice and realize, oh, actually, I don't want this, right? So you may not know exactly, but an idea of how you want to direct your career, because you could end up disappointed.
Thank you for that. Thank you. Thank you. Dr. Camille?
Yeah, so an experience that I thought was unexpected was really that as much practice as you have, the mistakes are going to happen. That's never going to go away. So you have to ultimately learn how to be confident in your skill. And when you're not confident in your skill, you got to fake it until you make it. And when you can't fake it until you make it, you just have to be honest. And I feel like, so ultimately, I think that stems where I learned that from was my residency. My attending was amazing. She's this little small Hispanic lady, and she has been a dentist almost my entire life, and I am 27. And to see her still make a mistake, and it's not like what you think of a mistake is, but it's like where it's like it's an uncontrollable situation and then something happens, right? That's going to happen. It's how you choose to react in that moment. And that is going to be the most important thing. Are you going to be honest with your patient and then have them potentially know what happened, but then in the end, they trust you even more? Because sure, you can go ahead and lie to them, but then what if they know more than they're letting on? Because patients will always do that. And then it's like, well, I kind of knew that already. So then it seems like you're being dishonest to them, right? But if you're straightforward and, give your all in something, they will see that and appreciate that 10 times over you trying to portray this perfect image that I do feel like a lot of doctors try to do because dentistry is so messy. No one tooth is the same, and it could be the same, it looks the same on the x-ray, but you get in there and it's completely different. And everybody, you could, it could be perfect margins, perfect everything, and then it's reacting different. That's the tooth. And that's nothing I can change or you can change, but that's something that the patient doesn't understand. So we have to bridge that gap for them to help them understand it. And I feel like in my residency, that's when I really learned it. I was like, in dental school, I felt like, oh, I just need to get through. I just need to get through. And once I get through, everything is going to be fine. And it's never going to be fine. It's not like I'm trying to burst your bubble, but it's not. Every day there's a new problem. And it's not like always a clinical problem, but it's always going to be something new. So what you need to learn, what I am still learning, is how to adjust, how to calm yourself in the moment and know who you are as a dentist, and you will figure it out. But it does take some time to get there. But know that you're not alone in this. It happens to everyone. And like I said, my attending who I would trust my teeth with, right? It happens to her. So if it happens to her, it will happen to us. And it's never going to stop.
Can't tell if I'm inspired or scared, but
To piggyback off of that, it's true. It's true. It's called the practice of dentistry. Okay. The majority of people who get into this field, we are perfectionists. We want everything to be perfect. Dental school trains us in a certain way that if we're not perfect, then we don't get a good grade. So it's kind of entrenched in us, but that's not real life. That's not real life. You're going to perf. You are going to, you're gonna break a root. You're gonna do something that would ruin your whole day. And then in the first few years of your career, it is gonna ruin your whole day. I remember I perfed doing an endo and I was about to cry and my attending was like, take it out. And I was like, oh my God. And then she's like, the decay was to the furcation, you perfed. I saw that in the x-ray already, but you didn't catch it. So it's okay. Take it out. And they're just so calm about it. And I'm just like, what do I tell the patient that you're taking out the tooth? And so it's like, things are gonna happen. And then breaking a file, doing all these things. And then they're just like, if you do enough endo, you're going to break a file. And everyone's just so calm about it. And I'm internally freaking out. So it's one of those things that it's going to happen. Keep getting your training, keep doing what you have to do to be able to manage when those things happen, but to be able to manage speaking to your patients. And one of the biggest things is being honest, right? You never want to be that person that they go to another dentist and they're like, oh, did you see this broken file? Yeah, actually, my dentist informed me of that, right? Because you never want to look bad. You want to be honest with your patient. You want them to trust you. When things happen, you let them know. I show them the x-rays and they move accordingly from there, right? The majority of patients are going to be okay. They're going to stick with you. Are you going to have a few that leave? Sure. But that's just the reality of it. You're going to beat yourself up, so I'm not going to bother saying don't beat yourself up, but we're just here to let you know that it happens to all of us, and you will be okay. Dental school trains you in a certain way. You guys are still in dental school, so you have to follow that. But real life dentistry is not the same. It's a little bit of the Wild Wild West when you get out, especially in private practice, because there aren't really checks and balances in the sense of anyone looking at you, right? Everyone can practice the way they want to practice. Everyone does the way they want to do. Unless someone gets reported, no one is going to the offices to check if you have the right supplies, if you're doing the right thing. So you really have to have your integrity in your training and what you do to know how you want to practice, because you will go into practices that are crazy. and the doctors is doing a lot of crazy things, and you're just like, I just graduated from dental school. Who am I to tell someone who had a practice for 30 years that you're not using a rubber dam for endo? So you just sit there and you watch them, and you're like, please don't let an endo end up on my schedule, because you don't want to do endo without a rubber dam. So it's things like that where it's just like, I would say that, going back to the first question and the advice that we gave there, go to the practices before you start working there to see how they function.
Thank you. And our final question for me before we open it up to the floor is, now that you're working, which you guys already kind of touched on, but do you have any advice for our future dentists?
All right. Great points. Camille, you got a little dark there, but you're keeping it real. So yeah, as I mentioned before, and as many people have mentioned tonight, my advice is to network early and network often, especially if you feel that you want to practice straight out of dental school. Don't wait until May to apply for jobs. I would say start seeking out potential work opportunities as early as you can. Some ways of doing this is, there's always local dental associations in wherever you live. If you're not going to school where you might end up living, that I can understand how that's a little tough. But if you do, let's say, go back home for the holidays or for the summer or whatnot, that's your opportunity to start to network and meet people. But yeah, the local dental associations, if you go to them, they usually meet once a month. And there's so many older dentists there, and a lot of them are, maybe not looking to retire just yet, but looking to bring in an associate with a plan to buy them out, things like that. There's just so many different opportunities. I would say another way is, I know some of my friends got jobs by speaking to faculty actually at the school and seeing who that, if any of their friends were looking, or maybe they knew of offices, and some faculty did put them on. So that's one way. I know that's not always going to work also, but that's another way. And participating in school networking events. So Rutgers did a great job, I think, in like last year for D4s in putting on a lot of events. A lot of people did not take advantage of them, but they would have alumni come, and those alumni are goldmine. A lot of those alumni, especially the ones that are like 10 years out, they might be in a position where their practices are, busier, and they need extra hands. So they might be looking for associates. So I would say it's tough. I would say, especially as women of color, can be intimidating if a lot of these people don't look like us. But it's an investment in yourself. It's an investment in your future. Some of us may be introverts, and I get it. It's not the most comfortable thing to just kind of go up to a stranger and start talking to them, but start by picking their brain, start by asking them questions. Everything doesn't have to be straight to the point. You can just start building a relationship, get to know them a little bit, ask them questions, maybe ask them to shadow, go from there. You're not going to meet the perfect person, and they're not going to hand you the perfect opportunity. You have to put in a little bit of work in building a relationship with certain people to find a good opportunity. As we mentioned before, and as Dr. Emma just mentioned about like having integrity, private practice can be very frustrating, especially if you practice in an insurance-based practice, which I do. We don't accept Medicaid, but we do participate with a lot of PPOs. And the reason it can be frustrating is the reimbursements. So I strongly, strongly, strongly advise that when you start working at a practice, whether this be straight out of school, whether it be after your residencies, ask for your production sheets, ask for some evidence as to how they're calculating your paychecks, because that's going to give you the best insight into how the business side works. So, for example, most of you will get paid biweekly, maybe direct deposit. So ask for the breakdown of how your pay was calculated. Most of you will be getting paid 30 to 35% on production or collection, but usually there's an office manager or someone in the office, payroll manager, someone who's calculating that. So they should be giving you that report. That way you'll get an idea of like what the fees are that, you're actually charging out to patients, what your 35% of that looks like. I think it's very important to understand how you're being compensated. However, I think it's also important, as Dr. Emma mentioned, to like keep your integrity with this. And I think that has to happen from day one. So don't dictate treatment and determine treatment plans, or don't treat patients just based on kind of what their insurance situation is. To a certain extent, you have to be smart. But on the other hand, I think we did not come into this career to look at patients as a dollar sign. We have to make it work for us, but I think keeping your morals to it from day one is extremely important. And I say this because I've worked in the dental field for a long time. So I'm 35 now. I've worked in the dental field since I was 15. I've worked administratively, clinically, and I've witnessed the pressure allow people to take a turn for the ugly. You don't want to end up there. I think that while it's important to figure out how you're going to make money, and there are ways of doing that, like we said, taking high-level CE, diversifying yourself, investing in yourself. However, the money is not everything. The money will come when you do the right thing and treat your patients well. So just be careful of that. I think now more than ever, with how much debt we're graduating with, the pressure is there. The pressure is real. And you don't want to waver on your morals, I think, especially in this field, because it's very easy to do so. As Dr. Emma said, nobody is watching you. You're the only person watching you, really. So just keep a good watchful eye on yourself, basically. So yeah, that's all. And if anybody wants to know more about like CE, or just anything I've mentioned, please feel free to text me, email me. I'm happy to give anyone any advice after this chat.
Thank you, Dr. Jaya.
Okay, so I think everything Olga mentioned is pretty much my advice to all of you. That was very insightful. So definitely, when you're going into your first jobs, there's a lot of things that you're not going to know, and you're only going to learn it by experience. But the biggest thing, like Olga mentioned, is advocating for yourself. So making sure that you're only doing procedures that you feel comfortable doing, because a lot of offices, I feel like, whether you're in a DSO or private practice, will sometimes put patients in your schedule and say, okay, do this. You figure it out as you go. And it's like, no, if I don't feel comfortable doing it, I'm not going to do it. So don't do it for the money. Don't do it for the experience. If you're looking for the experience, take the CE courses, do a GPR, do an AEGD, learn under someone's guidance who has done it before and is proficient in it. Because at the end of the day, these are patients that you're working on, and you wouldn't want someone doing that to you. So that's how every patient that comes in my chair, that's how I treat them, as if it was me sitting in the chair, and what would I do? I'm not looking at, like she mentioned, how much money you're going to make on the procedure, solely based on the procedure I'm doing. Can I do it well? Like Dr. Emma mentioned, sometimes you're going to run into hiccups. Not everything is going to go as planned, but that's okay. You let the patient know in the beginning, and you work it out, work from there. But just knowing that you have their best intentions in mind is very important from the beginning. And also, like Olga mentioned, making sure that the office that you're working at is transparent about your pay, because you can work at an office in the beginning and they're like, okay, paying you on time and everything seems sweet. You're making a lot of money. You don't care about, how much you're actually supposed to be making, because the paychecks come on time. But making sure that you're getting your production reports is important to keep track of, what you're doing, and making sure that you're being paid the right amount. Because even if it's $500 or $100, like, it makes a difference. So you don't want to be stolen from. Sometimes people make mistakes. So sometimes there may be errors in those reports, but it's just something, that you can keep a watchful eye on, just to make sure that everything is going smooth. And if you notice something is off, bring it up to whoever you report to, whether that be the practice owner, office manager, whoever, right away. Don't push it off and wait like months for things to pile up. Try to be as transparent as you can be. And that also goes for referrals. So when you're taking the job, make sure do you have, an oral surgeon that you refer to? Do you do oral surgery? Do you have an endodontist that you refer to? Like, get to know how the office runs from the very beginning. because you don't want to get stuck in an office that doesn't, run as ethically as you practice. So that's very important. Because like they mentioned, the money comes. So don't, even though we have a lot of loans and we want to make a lot of money, the money comes. It's more important for you to have your own sanity and make sure that you're, keeping your license protected pretty much. But yeah, so that's pretty much it.
I would agree with what was already said. Make sure you keep your integrity. Make sure you check on your pay, check on your production. I would even recommend, I know you already got a lot to do, but the D4s, I would recommend looking at the numbers of what you're doing with your patients and the procedures. Like, since, because I know D4 year, I had time, right? I had time when, I wasn't, because all you're doing is seeing patients. So that would be a great time to start looking at the numbers to kind of see and make sense what we're talking about, where we're saying, okay, is this procedure worth your time? And to that degree, you have to get over like that ickiness that feels, where it's just like, I'm not doing this emergency procedure because it doesn't make enough. So you also have to pay your bills. You also have to make a living. So it's one of those things where you have to kind of toe the line with how much you're caring about money. So we're saying do not treatment plan 5 root canals and 5 crowns when they don't need that. Right? We don't care about money in that sense. But when it comes to certain things where it's just like, okay, this $20 limited exam and this $40, like I already know that I'm sending you to OS. Like what that $20, so not even 20, that $2 I'm gonna get from that limited. I know that took 5 minutes of my time because I already looked at the x-ray. That's going to OS. The assistants already have the referral written up. And I'm sorry, I could send you some ibuprofen. Like, and honestly, it is what it is, right? You're gonna feel achy in the beginning because you're like, I could do that extraction, right? Now, unless I have no patience and I'm like, well, I was gonna make $0 this hour anyway, then you take that patient. But if you have 5 people waiting, and then if you get stuck in that extraction, God forbid, now you just derailed your whole schedule. Nah, get that referral ready. The assistants already need to know. They already have it there for me because they took the x-ray and they know what's up, right? So work with your integrity. The money will come. You're a good provider. You're empathetic. You do good dentistry. You treat your patients well. The money will come. Mentorship is important. Make sure you get mentors in what you want to do. And then if you don't know what you want to do, get mentors in the 2 or 3 areas of what you think that you want to do. Okay. Networking. Organized dentistry. I'm an organized dentistry girly. I'm in all the things. So I think it's extremely important. There's so many, and like I said, I don't want to own. There's so many of these people at the meetings that like because I'm trying to sell. Like they trying to get rid of these offices and they trying to unhand these offices and they've got no one to sell it to, right? Because we've been just so disgruntled about the field where I'm just like, when you're young, those are the people you need to be talking to when you're young and so happy about everything. These are the people you need to be talking to, okay? To get into those practices, see how they run, and see if that's something that you would want to buy into if you know that you want ownership. And it's important to be an organized dentistry because we should be advocating for our profession. And what else? I think I said all the things that I wanted to say, but I'm gonna drop my information in the chat, and you guys should have it already. So you could stay in touch.
And for me, I agree with what everyone had to say. I know that it's like we're kind of being repetitive, but it is something that is just so important. Clearly, if all 4 of us feel the same exact way, it's probably our number one thing, you know? That being said, mentorship is so important, but you have to be careful who you get mentored from, and you have to be selective. Like, yes, this person can give great advice clinically, but is he or she telling you things that is going to make you a great overall provider? Because they know the tips and the tricks with the codes and all these things to make it seem like, or for you to make more money on paper, but are you actually doing those things? Are you billing out what you're doing? So yes, it may seem like it's okay because who's really going to come and check this? But just like how they say, like, weed is a gateway drug, you never know what's going to be a gateway for you to be like this big scandal and for you to do all these things where it's like now you're in this situation where it's like, how did I get here? You have to be older dentists do it. I see it time and time again, and it's just a little sketchy to me. And there's no shade because I'm so happy it worked out for them, but that's pure luck. Who's to say that it's going to work out for us? So you have to also be careful who you're taking this mentorship from, and not all mentorship is going to be good. And it's okay if part of it is good and part of it is bad, but you have to know yourself um, to be able to take what you need to take from them and not take other things.
Thank you, ladies. Definitely pays to be honest. So let's just continue to be honest. So now we're going to open it up to the floor. We're gonna have a Q&A. I did have questions that came in beforehand, so I'm just gonna ask those real quick in case these ladies are inside the chat. And number one is, what do you recommend for a confident fourth year AEGD or community health? This is how they wrote it out in the question. I guess they're NHSC scholar. I'm not really sure what that is, but
Okay, so I can take that question. My AEGD was like through like a community health, and she wasn't my attending, but she was just a provider in the office. Um, she was young at the time. She was like 29, 30. So like I felt like her and I were like very similar. But again, she went to school in Florida, so she went straight out. And then she also got the NHSC scholarship. Um, and she worked at my office for that scholarship. And on the flip side, I was the resident and she was a provider. So if I knew more, this is where like doing your research comes into play, right? It would have been better for me to try to get that scholarship and work at a place like that, because not only would I be making money, I would be getting money to go towards my loans and then she was also learning at the same time versus me. I was there to learn. And yes, there were like clinical things, not clinical things, like academic things that I was learning that she wasn't, but it wasn't anything where I felt like it was such a big significance. If you can go that route of doing that scholarship and being in community health, you have the world is your oyster. You're going to learn so much. Um, just because these are patients who don't have any money, who are underserved, and there's other providers in there who are willing to help you get to the point where you need to be.
okay. And do you feel as though a GPR or AGD help employers feel more confident in your craft? Is the second question.
I would say it depends on where you live. It depends on where you live. There's certain areas, like Dr. Camille was saying, where it didn't matter for her. In Florida, in New York City, people do care a little bit more, especially as a new dentist. Like once you're seasoned in your career, no one's asking me where I did residency. But especially when you are from the NYUs, you are from, the schools that have 500 students, the way they're going to differentiate you is based off where you went to residency. So they're going to be like, oh yeah, that's a good residency. All right. Because, regardless of what people feel about NYU as an institution, everyone is aware of how many students they have. So there are certain people who question, how much were they learning? What was the quality of that when there's so many students? So in New York City, I would say that they definitely cared about where you went to residency. When it comes to GPR or AGD, there's a lot, mostly in New York City is GPRs. I like AGD was not really a thing. Like there was a lot of AGDs upstate, or my friends who I know who did AGDs went to other states and then came back to New York. I would say in terms of their experience, I would agree with Dr. Camille as well that I feel like they had a better experience than we did in terms of training, just because I do feel at GPRs we're kind of workhorses and you learn what you need to do because you have to, right? Like you have a higher flow of patients, you're going to see a lot of emergencies, so you're going to learn endo, you're going to learn extractions, you're going to learn how to troubleshoot things because of the patient population at a hospital versus like my girlfriend who was at an AGD was placing implants and doing full mouth rehab and doing a whole bunch of other things, learning about the insurance, right? Not like her first day at work. I'm like, wait, I can't do this. They were learning about that beforehand. So I would say if I did it again, I may have went to an AEGD versus a GPR. But in New York City specifically, or cities that have a lot of dental schools that may be super saturated, they would prefer or they would care about where you went to GPR versus other places that. And honestly, besides New York, no one else requires a residency. So they're not really like, oh, students have to go to residency, and I care so much about that because they don't really require that in other states, and New York City does. So specifically in New York, yes, they care. Jada has a question.
Hi, everyone. My name is Jada Graham. I'm currently a fourth year at the University of North Carolina, Chapel Hill. First, I want to just thank you all for all the advice you've given so far. I have decided that I'm not going to do an AGD or a GPR. So this question is about transitioning directly into private practice. I currently have 2 job interviews, one at a DSO and one at a private practice that is fee for service. So my question is, I recently got some advice from a graduate in the class of 2024, and he told me that if I could work at 2 places, both part-time, one W-2 and one 1099, that would be like, he was saying like, well, if you have one job, then if it doesn't work out there, then you can go to the other job and then you can try to finesse benefits out of the W-2. So like, dentistry is going to be my first job ever. So I've never even filed taxes. Mm-hmm. So all of this like 1099, W-2, like I don't really know what that even is. So my advice to you is, my question to you is, what do you think I should do? Like, do you think working at multiple practices, trying to get different benefits from each practice is best, or just start one place and just figure out my life first and then open it up to more than one practice?
I'll take this question. I'm dying to take this question. Thanks for asking. I'm sorry, what was your name again?
My name is Jada.
Jada. So as I mentioned, I had another career before dentistry and I was an accountant. And I will tell you with 100% certainty, do not accept any jobs that are offering you 1099 as a general dentist. Don't do it. If you're a specialist, it's a different story. But as a general dentist, legally, tax law says that we don't fall under the category to be paid as a 1099. The reason an office would want to pay you as a 1099 is because it benefits them. They are not paying into any of the Social Security and any of the benefits really or they're not paying taxes for you as an employee. So for them, they are happy, right? They're paying you and that's it. But what happens on your end is you're not paying taxes on that money unless you're putting money aside, and you have to kind of create your own business, which is money out of your pocket. Then if you don't have enough expenses to claim as this business, you're basically getting taxed, double taxed. You're getting taxed as the employer of that business and as an employee. You're paying just way more money. Like, someone who is hiring you needs to hire you as a W-2 employee. Don't accept being paid as a 1099. Another thing is, when you go to, like, let's say, look for your first home, 1099 employee, you're going to need 2 years of work of like income before they would even approve you for a loan. A W-2, you need like 2 pay periods worth. Do not accept getting paid as a general dentist as a 1099.
Okay,
in terms.
that makes a
Yeah,
lot of sense. It
yeah,
does when it comes from what I do know about taxes. A lot of the people that have given me the 1099 advice, they're like, okay, if you're going to be 1099, you have to have a really, really, really good financial team, like financial planner, this, that, and the third, because you have to make sure that everything is in order because that kind of structure isn't built into your job. So I do get that the W-2 is the better option, but also as somebody who's like turning 26 this year and then getting kicked off my parents' insurance to have to do all of this financial stuff like fresh out feels like I feel like I would be a little distracted from the dentistry trying to get all my other finances in order. So I get
I
that.
totally get that. And so with that, being a 1099 employee would just complicate your first year of work so much more versus just being a W-2 employee. With the decision of whether you go for the fee for service office and whether you go for the DSO, there's so much more to know about that. Like, is the fee for service office offering any benefits? I mean, flat out, a fee for service office is a gold mine opportunity. Honestly, why? Because the reimburse, you don't have to worry about the whole insurance reimbursement situation. You don't have to worry about treatment planning from an insurance based perspective, and likely you're going to have the time that you'd want to kind of provide quality dental care. Not saying that you can't provide it without that amount of time. I'm just saying it's a more comfortable situation. However, are they willing to offer you benefits? Do you know that much? Do you know like what they're willing to offer?
No, so I have a conversation with the like owner doc coming up in January prior to my interview because he did extend me the interview, but these are some of the things I want to know before I go for the interview. So
Yeah.
those are the type of questions that I was going to ask him in that first meeting.
Yeah, I would ask, like, as Dr. Emma mentioned earlier, do they offer 401k plan? Do they offer insurance? The buy-in might be more because they are private practice. Private practices don't get the same rates that corporate gets. So, insurance is more expensive. Things are more expensive. But, I would definitely just have all of the facts before you make your decision on health insurance is a huge one. It's a determinant for a lot of people of which way they're gonna go. But I would say once you have all of the facts, or even before you meet with them, if you want to shoot me a message or give me a call, I can tell you kind of what to ask for or what to ask each scenario. And then once you have all of the facts, you can make your decision. I would say until then, get as many doors open as you can. So just continue to look for opportunities that might pan out. Don't put all of your eggs in either of these two baskets yet.
Okay, thank you so much.
Yeah.
And we have a
Sorry, I just wanted to reiterate something that Dr. Olga just said. Don't put your eggs in one basket. I know in the beginning I did it just because you don't know how you want to practice. You don't know if you're going to like the practice. They could promise a lot of things in the beginning, and then when you finally actually go there, it may be different. So when I was starting to work, I would not agree to work anywhere 5 days a week and take up my whole time because I'm like, what if I don't end up liking you? And then now I'm stuck there. So I preferred working at different style practices so I could see what I like. Would it be, ideal to be at a practice that's going to give you benefits and all these things? And then, you have your other practice that like I called like my make money practice, like this was my play money practice. And the other practice was my actual life practice. Yes. I don't know how it is in other states, but I know in New York City, what Dr. Olga was saying in terms of the tax aspect of it, 100% accurate. It definitely is more difficult. But working in New York City as a new dentist and being in the city, like you could be in Long Island, Staten Island, maybe you're probably going to get W-2, but unless you're in a corporation, a hospital, or a school, you're not going to get a job if you say, like, I only want 1099. I mean, I only want W-2. These jobs are not paying. They're not even offering W-2.
That is nuts.
And New York City is the jungle, okay? Like, you're not going to have a job if you say, I need W-2. They're not doing it because they're real cheapy. Even though, yes, technically, we know tax-wise, we are not W-2s. We're not 1099s. We're not bringing our own supplies. We're not doing all those things. So we are not independent contractors. For you guys who don't know what we're talking about, a 1099 is an independent contractor. That means that I am not your employee. I'm going there and I'm working. I'm bringing my own supplies. I'm my own independent person, and I'm going there to work in your practice. As a GP, you are not. But they do that so they don't have to pay all these different taxes on you. They keep their practice a certain number size of people so they don't have to give benefits even to their employees that are W-2. So there's a lot of things that happen in these practices for them to save money. But it's gonna depend on the city you're at. Not a lot of places, like there's places who I even mentioned it because they told me this in residency. Do not accept 1099. And I was like, oh no, I prefer W-2. They're like, we don't offer that. So it's either take the job or don't have a job. Like, so it may depend on the city, but New York City is the Wild Wild West. Like, unless you were at a hospital, a FQHC, or a corporation, like most people were not getting W-2s. Like my only friends I knew that had W-2s they were in Long Island, Staten Island, Westchester. They were like not in the boroughs proper. And that's just unfortunately how the industry is, because like I said, there's no checks and balances. These private practices could do whatever the hell they want to do.
I definitely that's a New York thing, girl, because I only know one person in Jersey who got swindled into being a 1099 employee. Everyone else, I mean, Jaya, Cam, are you guys W-2 or?
I am 1099 in my private practice, and everywhere down here is 1099. Like,
yeah, like
when you said that, like the whole W-2, I can't go in there and be like, I need to be W-2.
You're not gonna get a job.
That is a crime. That is crazy.
Nobody's doing that down here.
No. I'm speaking from my limited view. Then that is correct. That is crazy.
I've been out for 8 years. They're not giving us W-2 out here. Not in private practice.
It depends on the state, I would say. I got offered a 1099, did not accept that job. There are, like I said, a lot of options, so keep your options open. You have to do what you have to do at the end of the day. I'm W-2 at both offices that I'm at. But like, if it depends on where you're at. So like I said, don't get swindled or just accept a job just because they're paying you. See, if there's other options available. If not, you have to do what you have to do, but just be well versed in, like Olga said, if you have to pay those taxes, know how, or have a dental specific accountant that's going to help you figure out, because at the end of the year, when you have to pay that money, you better have the money to pay. So make sure that, like I said, the accountant or a lawyer, whoever that you're hiring to review all these documents, are dental specific, because you don't want to get sucked into something that is not good for you.
So we do have another question from Marion. Mine?
Oh, yes. Well, I don't know. I had like this, I guess, a loaded question kind of. I'm only a D2, but like now after like I think I thought that I was like at least kind of narrowing down what I wanted to do, and now I'm just like, oh my God, I don't know what I want to do. Because I was super well, what my school has just kind of informed us, because I'm still at a new school. But they're informing us now that during our fourth year, it was supposed to just be in the four-state region that they want us to do. We're going to do two 12-week rotations our fourth year. And they want us to go into either like a community health center or FQHC. But now they're just telling us, oh, we can extend it. We can go wherever we want to. As long as we're able to reach out and they get the contact information for those places. And they can kind of make sure that everything that we need is there. And I'm interested. I'm from New Jersey. I'm interested in going back towards that area, and I was interested in seeing about New York. So I don't know if this is like maybe a conversation that Dr. Emma and I need to have on this side, because I do have like a billion questions about what I should do. And I was kind of in a sense set on like I'll probably do a GPR, but now I'm like I don't know what I want to do. And I mean, I guess as a D2, I mean that's like kind of soon anyway, but our school is kind of narrowing down. So it's like, you guys need to know what you want to do. So I don't really know. I'm just kind of like, I guess for those of you all that did decide, I guess okay, I just seen your, your message at the bottom. Okay. I'll do that, but I guess, I don't know. That's it. I'll ask Dr. Emma on the side since I have all these loaded questions.
Is this program during your 4th year? You could get to decide where you want to go?
Mhm.
Okay. We could have a specific
Yeah.
conversation if you want to talk about New York, but what I would just say, just generally, is you have the next year and a half to kind of figure out what you like, what you want to do research, talk to different people, talk to people who did AGDs, talk to people who did GPRs, talk to people who are in private practice, because especially if you're going to be able to get that experience during your 4th year, that's going to be insane. You can make that decision of whether or not you even decide to do residency if you straight into private practice. Like, that's awesome. So I would say right now, use this year and a half to talk to different people to kind of guide you in what you want to do. And that year could be super impactful in the sense of that the trajectory that you're going to go through in your career. Or that year could be, I know this is actually what I don't want to do, so I'm going to do something else. Right? So, it's not loaded. It's not loaded. It's a good question. Just make sure that, you talk to different people and from different aspects, and then your New York specific questions, we can have a conversation about that.
Okay, thank you.
So our Zoom does end at 8. Just so for the sake of time, I'd like for us to move on. If you guys do have questions, ladies, if you want to drop your email, Instagram in the chat, maybe the ladies could reach out and you guys can answer it there. But yeah, just because I want to hit everything that we were planning to do. So before we move on to the next topic, I just want to say that next month we do have a specialist panel. This is on January 12th. We do have a prosthodontist, Dr. Eva Cumming, orthodontist, Dr. Raven, oral surgeon, Dr. Portia James, as well as other panelists that signed up. But seeing how this panel went, we may have to split this coming up panel into 2. But we do have an amazing panel coming up. If y'all are not sure if you want to go to GPR, AEGD, private practice, and instead you want to specialize, I do recommend coming to this. I, for one, did not realize I wanted to specialize until my 4th year when all the applications were closed. So this is something that I feel would have been big benefit if like I was in D3 year. So definitely recommend coming to that. Also follow us on IG at The Ambitious Dentist. That's dentist with the S, because we are all ambitious. And we do follow back. And that is the best place to get up-to-date information on our upcoming meetings. We also have socials. Our last social was a wine and vision board night, which was really fun. So yeah, just becoming part of this community, I think it will be very beneficial for a lot of people.
Recommend
let's go
everyone
on.
go to the specialist panel, even if you don't think you want to specialize, because I didn't think I wanted to specialize. And then I didn't, but that was because I'm already making money. I got bills to pay. I'm the breadwinner. Like, I can't go into specialty now anymore. And I feel like if I learned more about it when I was in dental school, I probably would have. So everyone should do the panel, even if you don't think you want to specialize.
Thank you. So the ladies were kind enough to bring their resumes or their experience for this resume building workshop. And basically, there's just a couple questions. Like, what's one thing we should highlight in our resume? What's more important, the interview or the resume? And a good question I received was, how should I list my clinical skills or procedures I'm proficient in my resume? So if y'all can touch on these questions or give us a detailed example of your resume and how that experience was going from job to job, that would be very beneficial, because we do have, like I mentioned, some D4s that are ready to apply to jobs and we're not sure where to start.
I'll go. I would say I'm going to answer the middle question first. If what's more important, the interview or the resume? I would honestly say the resume, because that's what gets you the interview. You're not if they're not impressed with your resume, you're not going to get an interview. Now, are there some practices that will maybe interview every single person that they see, they get a resume from. So then your interview has to be impressive as well. But if they're not impressed by your resume, you're not even going to get the interview. So I would definitely say the resume is more important. And in terms of what you should highlight, especially as a dental student, it would be any if you have any certain rotations or anything that you're any what did we have? We had minors in my dental school. So I was in the aesthetic minor. If there was anything clinically that is out of the ordinary, that is extra, something that you're doing, you should definitely highlight that in terms of clinically, and definitely highlight any involvement. The same way how when you were applying, to dental school and you had all these things, it's the same thing when you're out of dental school as well. Now, there's certain things that need to be emphasized more depending on the type of practice that you're applying to. Definitely the clinical needs to be emphasized, and also your extracurriculars and what you do needs to be emphasized. And in terms of how you should list your clinical skills, have a section that says it's your clinical skills, right? And then list it. Be very obvious. People don't want to have to guess. People don't want to have to read a lot of words. Literally, okay, clinical skills. I was an aesthetic thing. I did a rotation at the endo thing. I did list what you've done.
Thank you.
To piggyback off of what Dr. Emma said, I don't know. I know that you guys all go to different schools, but at Rutgers, one of the big things that I think will always shock people is that our requirement for crowns it's 19. We have to do 19 crowns, which coming straight out of dental school, it's
put that
just
in your resume.
put that in. But so even if your requirement was 4, but you did 10, put it in your resume and say that you exceeded your requirement amount. You know what I mean? So any little thing like that, it's gonna help you. It's gonna show that you were ambitious throughout dental school, that you are able and capable of working hard and putting your best foot forward. So anything that's gonna make you stand out, even the smallest thing, you don't know what people are looking at. The way I got my sorry, my private practice job, I did my residency in this nowhere name thing, but I happened to put the name. It's NYU Langone I did it through, but I put the specific site in Fort Myers, Florida, which is a very small area of Florida. Because I put that, my interviewer also worked there 14 years ago, and she knew the clinical ability that I would learn from working there for 1 year when she worked there 14 years ago. So put any little detail that you can. Don't overdo your resume. Try to make it as concise as possible, because nobody wants to be reading. If I see a dense thing, I'm ugh. But try to make it as precise as possible and give as much bang that you can give.
Okay, I guess one thing to add, so definitely what Camille and Dr. Emma mentioned. I think both the resume and the interview are both very important, because the interview you get to explain, everything that you've done. Because like Camille said, you want to keep your resume very concise. No one wants to read a 30-page document of everything that you've done. And most dentists all have similar training. So on your resume, you want to highlight anything that's unique or specific that you've done, that other dental students may not have done. So any community outreach that you've done, mission trips, if you're part of any clubs, SNDA was one, an aesthetics club or something that you're interested in, I would say to highlight on your resume. Also, a fun fact, I would say, would make your resume probably stand out from other resumes. I think that's something that makes you more personable. So things that you like to do, whether that be dental procedures or just day-to-day life, would be important. And I think that would make your resume stand out from other applicants.
Did y'all put your GPA? Or is it necessary to put your
I
GPA?
I did not put my GPA because in my opinion, it no longer matters. You graduated, you have that degree. You're good to go. Nobody cares anymore. If you can, people can have this terrible GPA, but their clinical skills are out of this world. And that's what's going to matter because maybe they're not a good test taker.
Yeah, I didn't put my
And
GPA on it.
Yeah, no. You're not a
what
school
I
no
will
more.
say,
You're in the real world now.
yeah,
Nobody care about your GPA.
if you feel like you're doing a resume right now and you're like, I have nothing, going back to what Olga said earlier, networking, if you can go and I know it's hard because you're working so hard in dental school and you're giving it 5 days a week. But if you can go and like find an office that's open on a Saturday and start shadowing, that shows if you're going there every Saturday, you're giving up one of your 2 free days, and it's not even a full, your weekends aren't really free. We know that. So you're giving up one of your free days to go get your mind in this mindset of practicing dentistry. That's also going to show them you're putting your best foot forward. So again, this is like if you feel like, damn, I have nothing, what do I show for myself? Try to find something like that where you can go shadow and like tell them about the procedures that you observed.
Does anyone else have any questions before we wrap things up? Hey, thank you once again, ladies. Y'all are awesome. Thank you for giving up 2 hours of your time to really educate us on life in the real world and what we should be expecting. Yeah, we have your Instagrams, we have your emails, phone numbers. Ladies, reach out. They are amazing. And please come to our next meeting.
Yeah.
And spread the word, please.
Yes.
Please spread the word. Thanks, everyone. Have a great night.
Good night.
Precious, good for you for putting this together.
Yes.
Yeah,
Thank
very
you.
valuable.
Yeah, I'm so proud of you.
Mm-hmm.
Thank you.
Hey.
Don't forget to
Thank
take a
you.
picture. Precious, don't forget to take a pic.
Did you take the
Yeah,
pic, Precious?
Rebecca did.
I took a couple
Amazing.
pics. Yeah.
Oh, actually, no, okay. Whoever, if they're still here, y'all want to turn on your cameras? Because I forgot to tell everyone to do that.
Yeah, let me see. Can you stop sharing your screen so that we can get like a full view of the gallery? Thank you.
Yes.
All right. Bye, y'all. Took it. Okay, great.
Good night, y'all.
Thanks, ladies.
Thank you.
Good night, thank you.
Good night. Rob, do you have the recording? Or
Yeah,
is it
once I
me?
stop I should have the recording. Once I stop the